Thrush, cystitis, and BV are all common conditions in women, but what are they and what are the differences? Hi, I'm Whitney and I'm a pharmacist at Boots. Today we're going to be talking about all things thrush, bacterial vaginosis, or BV for short, and cystitis. Stay tuned to learn about the key differences between them. Thrush is a common yeast infection caused by an overgrowth of a fungus called Candida that's found in many body parts including the vagina and vulva. Symptoms of thrush include white vaginal discharge that often looks like cottage cheese, which doesn't usually smell, along with itchiness and irritation around the vagina and vulva, and stinging and soreness when you pee or have sex. Cystitis is a common urinary tract infection or UTI that causes bladder inflammation. Signs and symptoms include pain, burning or stinging when you pee, needing to pee more often and urgently than usual, dark, cloudy or a strong smelling pee, and pain in your lower tummy. Bacterial vaginosis or BV is an overgrowth of bacteria in the vagina that can cause symptoms including unusual vaginal discharge with a strong fishy smell, greyish white discharge that can be thin and watery. Unlike thrush, BV doesn't usually cause any soreness or itching. It's also worth noting that not everyone with BV will experience symptoms. Now we've talked about symptoms, let's look at ways to treat each one. In some cases, thrush can be relieved with products available over the counter, including internal vaginal creams, pessaries, and oral capsules. There are also creams that can help provide relief from external symptoms such as irritation. You can ask a pharmacist for advice on treatment options that may be suitable for you. However, you should see a GP for thrush if this is the first time you have symptoms, you're under 16 or over 60, you keep getting thrush more than 4 times in 12 months, over-the-counter thrush treatments haven't worked, you're pregnant or breastfeeding, and if you have a weakened immune system, for example, if you have diabetes or are undergoing chemotherapy. Mild cases of cystitis often get better by themselves, but sometimes it needs to be treated with antibiotics. Under the NHS Pharmacy First service in England, Boots pharmacists are able to provide access and treatment, including prescription treatment for women aged 16 to 64 who are experiencing symptoms of cystitis. In some cases, UTIs are classed as complicated and a pharmacist will signpost you to your GP instead. You should see a GP if your symptoms haven't gone away within 3 days or after treatment with antibiotics, you keep getting cystitis symptoms, you're pregnant and have cystitis symptoms, you have severe symptoms like severe lower tummy pain, your child has cystitis symptoms, you are a woman over the age of 65, or if you are a man. Cystitis can be uncomfortable, but you can help to relieve symptoms by taking pain relief medication, drinking lots of water, using a hot water bottle to soothe, avoiding having sex, avoiding drinks like fruit juices, coffee, and alcohol that could irritate your bladder, and peeing regularly. BV isn't usually serious, but having it can increase the risk of getting a sexually transmitted infection. It can also cause a small chance of complications if you're pregnant. It's usually treated with antibiotics, so you should see a GP or go to a sexual health clinic if you have symptoms of BV to get further advice and support. In some cases, BV can come back even after treatment, but there are things you can do to help prevent it from returning and to help relieve symptoms if you have it, including taking showers instead of baths, using plain soap and water to wash your genitals, and avoiding perfumed soaps and shower gels, vaginal deodorants and washes, strong detergents to wash your underwear, and smoking. To recap, if it's thrush, the most common symptoms are white cottage cheese-like vaginal discharge, itchiness and irritation, and stinging and soreness. If it's cystitis, the most common symptoms are pain, burning or stinging when you pee, needing to pee more often and urgently than usual, dark, cloudy or strong smelling pee, and pain in your lower tummy. And if it's BV, the most common symptoms are fishy smelling discharge, greyish white discharge, and thin and watery discharge. If you're experiencing any symptoms, speak to your pharmacist or GP for advice and information. And if you're looking for more health-based content, make sure to like and subscribe to the Boots YouTube channel and check out our dedicated health hub for further advice and support.